Hello everyone, very good morning. We will discuss in a topic that is very essential to know for the new parents, that is febrile convulsion or fever associated with convulsion. This is a very common scenario we used to see in the families having the smaller kids or the babies with the history of parental convulsion, parental febrile convulsion. That means if the parents of or the father and the mother has the history of febrile convulsion in the childhood, in that case we often see the baby is present with the febrile convulsion. What is febrile convulsion? Febrile convulsion is convulsion or seizure associated with the high grade fever. This is mainly seen within 6 months to 6 years of life. And first of all, you have to know how to identify convulsion or seizure in a baby. There will be small changes or minute changes, but those are convulsion, like your lip smacking, like this, like your uprolling of eyeballs, and like sometimes jerky movements of hands and legs, and sometimes whole body movement, sometimes staring looks, looking at something or looking at some walls. That is also kind of convulsion. And what are the things you have to do when your baby or child is having convulsion? That is very important. That is very important to know for the parents. First of all, you take your baby to some place and keep her aside and lie his or her in one side. Then remove any kind of your tabis or any kind of restricted dress that is covering or that is compressing the neck. That has to be removed first. Then measure the temperature. Always do sponging, but never give any oral medication, any food, any water in the mouth of the baby who is convulsing. That is very important. Because the is not conscious, so if you give it in his or her mouth, the baby can get choked and die immediately. That is very important. After you sponge, and you always give midazolam nasal spray. That has to be kept in your home, because sometimes we see the patient is coming after 15 to 30 minutes to the hospital. In that case, long time gap and long time convulsion is already going on. So in that case, there is a definite injury to the brain and developing brain because of the hypoxia. We may not get oxygen every time. So the cases of the baby is having repeated episodes of convulsions associated with the fever, or not associated with the fever, having any kind of abnormality in brain, any kind of convulsion, seizure disorder, or any epilepsy, or any structural brain defect, or any history of birth asphyxia, delayed developmental milestone, I always advise them to keep midazolam nasal spray at home for emergency, and you have to give it according to the dose. And always after giving midazolam, try to come to the hospital, and the emergency pediatrician will see the patient and will clinically examine the baby, and he or she may advise some clinical laboratory test, and after that the baby will be managed. Sometimes there will be high or increased frequency of the attacks, increased frequency of the febrile convulsion episodes. In that case, there will be some investigation you have to do, special investigation like EEG or MRI vein, or the baby may have to take anticonvulsive medications. But basic principles are same. You have to give the fever controlling medication whenever the baby is having fever, and sometimes the controller medication, the baby or the seizure controlling medication when the baby is having repeated episodes of convulsion. So try to keep the temperature down. Always give paracetamol when the temperature is more than 100 degree Fahrenheit, and whenever the temperature is more than 102, try to sponge the baby with the tepid water or warm water. Hope you like this video. If you haven't subscribed my channel yet, please do subscribe to this channel of Child Health. We'll provide some important videos for the parents so that they can guide their child or baby at home with several topics I have selected. I will tell the basic things or the few important things you have to remember and you have to do whenever the baby is sick, and can be treated at home. But febrile convulsion is an emergency. Few things you have to do at home. After that, you have to reach the hospital to get the better management. Thank you. Thank you for your patient sharing.